I became interested in nursing when I was in Minnesota at the University of Minnesota. My thoughts were that I would become an oceanographer, and realized relatively quickly that there were no oceans in Minnesota, and my chances of becoming an oceanographer in Minnesota were really limited. So I had a close friend that was in nursing school, and she seemed really pleased about it and really happy about it. So I decided to go into nursing. So I went into nursing because there were no oceans.
Meryl is so unique because she is truly what we call a nurse's nurse. You know, individuals go into nursing for many different reasons. And yet there's this core group that really are attracted to nursing because they love to work with individuals and they really have this desire to make their lives better. And to me, that is what Meryl does the best.
I've worked with Meryl for close to 40 years. She was one of my first bosses in the ICU back in the day when families were only allowed to visit for about 2 hours a day. Most of the patients were sedated, so she really instilled in all of us young nurses that we were the patient advocate. So patient advocacy is just a big part of Meryl early on, where she taught us that we were their voice because their families weren't there and they couldn't speak for themselves. So I think that's one of the biggest things that she instilled in me.
I love patient care. Love direct care. When I was taking care of patients, I could make a difference to those patients and those families, but it'd be one or two. When I decided to go into leadership, it's because my scope would be broader and I'd be able to touch those who touch the patients. And that just seemed to make sense for me.
Meryl has a very unique personality, and she often comes across as being very direct. And, you know, sometimes when you first meet Meryl, that's a little shocking, and you're not really sure how to take her.
She has a way of encouraging folks, and if not, she kind of volunteer a lot of folks to do a lot of things that's not probably in their scope, but she pushes them to the max.
Meryl's known for posting a retreat event on your calendar, and that's not a day at the spa, it's not a getaway, it's a work day, and that's going to consist of lots of large post-it notes on the wall, lots of group activities, lots of doing deep dives into the research and what is the outcome, and then what steps do we need to take to get to that outcome.
Meryl fosters this community and this environment of passion about things like quality indicators that people don't really care about a whole lot. And then she makes it fun. So like with the fall committee, she created this little saying like MALARM, which just stands for Mat and Alarm, because we were bringing those into the hospital and nurses weren't used to those. And so she's like, do you have your MALARM, your MALARM? And then it just is like, it's silly, but it's cute, but it sticks with you. And so now when you're setting your patient up who's a high fall risk, you're like, gotta get my MALARM together. So that helps with the bedside nurses a lot, and then obviously patients too, so.
My fundamental belief is when we have problems particularly related to patients, when we have too many hospital-acquired conditions, when we have too many infections, the people with the answers are those nurses and technicians and those folks at the bedside. Nurses are awfully creative and they can figure their way around anything. They live it every day. Our answers aren't in the literature. Our answers aren't coming from someone else. They're not coming from senior management. They're not coming from me. They're coming from the frontline staff. They have the answers.
All nurses want to be able to practice at the top of their license and to implement best practices. And Meryl is very good at researching what the best practices are, looking at how other places have done it, looking at the national standards and saying, this is what we need to do here. This is how we need to provide nursing care here. So, you know, I think our patients benefit from that because Meryl makes sure that we're always doing those things. And to the nursing staff, you know, Meryl is phenomenal because the voice of the bedside staff is what Meryl wants to hear. So she is always able to implement what the bedside is thinking, what they're saying, and she's able to communicate that back and to make sure that whatever's going on at the bedside that they're able to hear.
Just her role in the Magnet journey has taught us how to be an advocate for our patients, and then that ensues quality of care at the bedside. And her methods, it reaches us every day and impacts our patients and us as nurses. I've been able to pass down leadership, advocacy, patience, kindness because of Meryl.
Her work allows us to be proud of what we do, as well as take pride in taking care of our patients. I mean, as nurses, we have compassion, but she gives us that extra energy, and she gives us that extra confidence, and also we look to improve ourselves, which in turn will allow us to be better nurses and improve the patient's safety. That is very important here at Atrium Health Navicent to us.
I think Meryl's biggest accomplishment of all was in early 2000s, our CNO, Ms. Stickle, wanted our hospital to take the Magnet journey and be a Magnet organization, and Meryl was her pick to lead us in that.
We are a fourth-time designated Magnet facility, and Meryl has been a part of that journey from day one. To have someone of her caliber for the entire length of time and to be on that journey with us has really made a difference for us.
I keep doing what I'm doing because I keep making a difference. I keep being able to touch someone. I keep being able to see a patient that I know would have gotten an infection, I know would have fallen, but because the frontline staff did what they were supposed to do, it didn't happen. So it's always that no one else has to tell me. It's what I just intrinsically know that I see, and I know that we've made a difference, and it's never me, it's always we.
All the different lives that she's touched, whether it would be as a patient or as a nurse, and the individuals that she's worked with and helped through problems and mentored, that has to be such a joy for Meryl to realize and understand all the different lives that she's touched throughout her career.
She's always going to take that deep dive into what's going to be best for them and then help us create the journey to have the best outcome. Congratulations, Meryl. I'm so proud of you for this Georgia Hospital Association Award. It's so well deserved.
Congratulations, Meryl, on your GHA Hospital Hero Award. This is well deserved, and I want to thank you for all the things that you've taught me over the years, and that this is a great accomplishment for you and your career.
Hi, Meryl. Just wanted to congratulate you. This is such a great way to honor you. We absolutely love working with you and having you as a part of the team. Thank you, Meryl.